Hello, my name is Ana Altamirano. I am a family nurse practitioner student, and today I will be doing a general health assessment. This is my student ID, and then we'll be doing a 360 of my apartment where I am performing the physical assessment. I will be reviewing the equipment that I will be utilizing throughout my assessment. So here I have my gloves, my stethoscope, my 512 tuning fork, my pen light, my salty water, my sweet water, coffee, vanilla extract, coin, cap, my key, my soft tip applicator, my sharp or toothpick, my cotton ball or cotton, my tongue depressor. This is my reflex hammer, the pen. I'll be using this to my otoscope and my ophthalmoscope, and I will be utilizing this throughout my assessment. I have already performed hand hygiene and I have gloves available. I have also received consent from my patient to videotape this assessment. Hello, my name is Anna, and today I will be performing a general health assessment on you, okay? What is your name?
Zoraida Cavazos.
Okay. So today we're going to start with your general history. Do you have any medical problems?
No.
Do you have any problems maybe with your lungs, with your heart?
No.
Any high cholesterol?
No.
Any problems with your kidneys, with your thyroid?
No.
Do you have any cancer?
No.
Do you drink alcohol, Zoraida?
No.
Any tobacco? Do you smoke?
No.
Any drugs, maybe in the past, marijuana, cocaine,
No.
recreational drugs? No. We're now going to review your allergies. Are you allergic to any medication?
No.
To any food?
No.
To something in the environment?
No.
No. We are going to review now your family history. Tell me about your maternal grandparents. What medical problems do they have?
My grandfather from my mom's side died at the age of 77 from a heart attack,
Okay.
and my grandmother is perfectly healthy.
Perfect. What about your paternal grandparents?
My grandfather from my dad's side died of kidney failure,
Okay.
and my grandmother suffers from dementia.
Okay. And what about your parents?
My mom is healthy, and my dad suffers from high blood pressure.
Okay. What about your siblings? Do they have any medical problems?
No, they're both healthy.
Okay. So I have reviewed the family history. I have gathered the medical history. Do you take any medications? I did not ask about
No.
that. Do you take any birth control?
No.
No. Okay. So I have gathered the medical history, the family history, the medications, the allergies. Now, any surgeries? Have you had any surgeries in the past?
Yes, I have knee reconstruction and a C-section.
Okay. So now I am going to proceed to the actual general assessment, physical assessment. I will be going through every system through the modalities of inspection, palpation, percussion, and auscultation. The only modality that does not follow that pattern is the abdomen. With the abdomen, I will be inspecting, auscultating, percussing, and then palpating. So I'm going to start with the skin. I'm inspecting your skin. I will be uncovering certain areas. So in case that you're a little bit uncomfortable or if there's anything, just stop me, okay?
Okay.
So sorry, the skin is tan. I don't see any rashes, any lesions, any bruises, or any scratches. Very good. I'm going to uncover your stomach just to see your skin. Sorry. Very good. I'm now going to proceed to her hair. Her hair it appears to be well attached to the cranium, equally distributed, is brown, appears clean. I'm gonna look just to see there's no infestations or pediculosis. Very good. Now I'm gonna inspect her nails. Let me look at your nails. Her nails are clean, round, short. The nail plate is flat, soft. There's no cracks. There's no swelling. Let me see this one. Very good. It does seem that your nails are just a little bit too short. Do you bite your nails?
I bite my nails.
Okay, that's why. Let me just look at the nails. But I don't see any fungus. If she were to have fungus in her nails, sometimes the nails look yellow and thicker. Her nails look thin or look adequate. I'm now going to proceed with your head, your neck, and your face. Okay?
Okay.
So I'm going to inspect. The skin in her face is clean, like she doesn't have any acne. The color is tan. It appears to be smooth. The same as in her neck. Her hair, I'm going to just palpate your scalp. She doesn't have any scars, any alopecia, any hirsutism. Also, she doesn't have a lot of hair. Her face appears clean. If she were to have a lot of hair, like hirsutism, that could be indicative of endocrine problems. I'm now going to, after inspecting, I'm going to palpate. I'm going to start palpating your frontal sinuses. If she were to have maybe sinusitis, she could be reporting some tenderness. So I'm going to palpate frontal sinuses. Do you have any pain?
No.
Now your maxillary sinuses. Do you have any pain?
No.
No? Okay, very good. I'm now going to proceed palpating her lymph nodes. I'm going to start with the preauricular lymph nodes. Okay, they are non-palpable. The postauricular, the occipital, the anterior cervical, the posterior cervical, the supraclavicular, and the subclavicular. And the lymph nodes are non-palpable in her case. If the lymph nodes were to be palpable, were to be non-tender, fixed, that could indicate malignancy. In this case, her lymph nodes are non-palpable and she's not complaining of any pain as I am palpating. I'm now going to palpate, now that I'm in the neck, her trachea. Her trachea is midlined. Can you swallow?
Mm-hmm.
Okay, very good. I'm also going to palpate her thyroid now that I'm in the neck area. So I'm going to go from behind and I'm going to be palpating your thyroid. I'm going to ask you to swallow, okay?
Okay.
If you need to get a little bit of maybe the sweet water, you can, okay? Feel free to do that.
Thank you.
I'm going to palpate, and I am palpating for any nodules or maybe if her thyroid is enlarged. Okay, swallow. Okay, which would be maybe like a goiter. In this case, I don't feel any nodules in the thyroid, or her thyroid does not feel enlarged. I'm now going to ask you to rotate your neck to your right and to your left, laterally. Very good. So she has full range of motion. Now that we're in the neck, I'm going to ask you, so right now her neck is extended. I'm going to ask you to hyperextend. What you would be doing is doing this to the back, okay? If you have any pain, let me know. Hyperextend, okay? And now flex. It would be to the front. Very good. Do you have any pain?
No.
Okay, very good. So her face, her neck, and her hair, I've already assessed. I'm now going to proceed to her eyes. I'm going to start inspecting her eyebrows. Her eyebrows appear symmetrical. I actually forgot to assess the cranial nerves in the face, so I will back up. I'm sorry. I will assess cranial nerve number 5, which is the trigeminal nerve. I am going to ask you to close your eyes, and you're going to feel a soft and a sharp object, being in your face. You're going to tell me the location and the sensation that you're feeling, okay?
Okay.
Okay, close your eyes.
Forehead sharp.
Very good.
Cheek soft. Jaw sharp. Cheek soft.
Very good. So with this, I'm testing cranial nerve 5, which is the trigeminal nerve. I'm now going to test, and it appears intact in her case. I'm now going to test cranial nerve 7. Cranial nerve 7 is the facial nerve. So I'm going to ask you, Sorena, to smile. Very good. Now do a frown. Very good. Okay, frown. Okay, I know it's hard right now, but very good. Now close your eyes tight. Very good. So cranial nerve 7, which is the facial nerve, appears to be intact. I am now going to test cranial nerve 11, which is the spinal accessory nerve. I'm going to ask you to turn your neck to your right, and I'm going to put some pressure. I'm going to kind of like not let you. And with that, I am checking her sternocleidomastoid muscle and the trapezius muscle. To your right, very good. To your left, very good. She has adequate strength, which indicates the spinal accessory nerve, cranial nerve 11, appears intact. Now I am going to move to the eyes. I am sorry. The eyebrows appear equal, symmetrical. The hair distribution is equally. I do see, though, a little scar in one of the eyebrows. Her eyelids, they're not swollen. They are symmetrical. They're not drooped. Her eyelashes, can you close a little bit so I can look? Yes, the hair is well attached to the eyelid. It is equally distributed. There's no infestation. She doesn't have any redness or any lesions. Open your eyes. I'm going to check now the conjunctiva. Okay, the conjunctiva. It's pink. It is not red. If the conjunctiva were to be red, it could indicate conjunctivitis. If she were to have green, yellowish discharge, it could indicate bacterial conjunctivitis. If she were to have whitish, clearish discharge, it could indicate bacterial conjunctivitis. I'm going to look at the sclera. The sclera appears white. It is not yellow. If the sclera were to be yellow, it could indicate jaundice, which could be related to hepatic disease. I'm going to palpate the inner canthus, the outer canthus. She doesn't have any discharge both in the inner or outer canthus. The iris is brown. The pupils are round. They're 3 millimeters right now. The cornea is shiny and transparent. There is no lesions noted in the cornea. I'm going to use my pen light to look at the pupils if they equally react. Okay. Very good. And both pupils are equally reacting to light. I'm now going to test for cranial nerve 2, which is the optic nerve. And I'm going to use this Snellen test to check your visual acuity, okay? So you can use your corrective lenses. I'm going to be using the Snellen chart in my computer. If you can stand at 10 feet from here. And tell me the smallest line that you can see. Covering one of your eyes.
Okay.
There we go.
LEFODPCT.
Very good. Now your other eye. Tell me the smallest line that you can see.
LEFODPCT.
Okay, now we'll cover both. Tell me the smallest line.
LEFODPCT.
Very good. So she has a vision of 20/20 using her corrective lenses. You can go ahead and take a seat. Now I'm going to be checking the confrontation test. Let me bring a chair over. And with the confrontation test, I'm going to cover my right eye. You're going to cover your left eye. I'm going to wiggle my fingers and you're going to tell me if you see them. This test is testing for peripheral vision. So cover your eye. Tell me if you see it.
I see it.
Very good.
I see it. I see it. I see it. I see
Remember to focus on looking at my eye,
it.
okay? Now cover your other eye. Focus at looking at my eye.
I see it.
Very good.
I see it. I see it. I see it. I see it. I see it.
Very good. Her peripheral vision appears to be intact. Cranial nerve 1 with the Snellen test was intact. Now I am going to test cranial nerve 3, 4, and 6. The oculomotor, the trochlear, and the abducent nerve. So with that, I'm going to ask you to follow my finger without moving your head, okay? And follow with your eyes, follow my finger. Cranial nerve 3, cranial nerve 6 without moving your head. Cranial nerve 3, 3, 6, 3, and cranial nerve 4. And all of those nerves appear to be intact. Now we're going to do the cover uncover. You're going to do the same thing. Follow my finger with your eyes without moving your head, but you're going to cover one eye. When I tell you to uncover, you will uncover. And for that, with that test, I'm looking for strabismus. So cover your left eye. Follow my finger. Uncover it. Very good. Cover your eye. Uncover it. Very good. Now your other eye. Cover. Uncover it. Very good. Again, cover your eye. Uncover it. Very good. So there was no strabismus noted with this test. I am now going to end the eyes with the ophthalmoscope. I'm going to dim the lights and I'm going to be looking for the red reflex, the most important thing. So just stare something straight. Okay, the first thing I see is the red reflex. It is very important. Very good. Okay, I see the optic disc, the macula. She does not have any papilledema. Very good. I'm sorry. You do want to do this somewhat fast because the light does bother the patients. Again, the first thing that you want to see is the red reflex. I see it. Okay. Very good. Very good. So I was able to see the optic disc. It was round in both her right and left eye. There was no cupping, no papilledema. Papilledema could be indicative of increased cranial pressure. Cupping could be indicative of glaucoma. The maculas, I was able to see kind of away from the optic disc in both sides. She did not have any, I did not see any hemorrhage. The optic disc appeared yellowish, orangey kind of color, but overall it appeared good. I'm now going to proceed to the ears. Let me turn on the light. I'm now going to leave this here and I'm going to assess the ears. The ears are symmetrical. The skin in the ears is tan, equal as the rest of the body. There's no redness. There's no secretions coming out of the ears. The auricles are round. They are not completely attached to the face. They are symmetrically pierced. I'm now going to use the otoscope to assess the external auditory canal. There we go. So I'm going to pull the pin up, backing up to be able to see the tympanic membrane. Okay, I do see some wax, but there's no foreign bodies. I do see the tympanic membrane that is pearly white. I'm able to visualize the incus, the malleus, the pars flaccida, the umbo, the cone of light is at 7. And she does not have any redness. It doesn't look perforated. There's no scarring. Scarring could be caused by a lot of otitis media, a lot of infections. There's no bulging, which could be indicative of otitis media. There is no fluid behind, which also could indicate infection. Now I'm going to assess the right ear. I'm also going to pull the pin and back it up. There is some wax, but there's no foreign bodies. I'm able to visualize the tympanic membrane. I'm also able to visualize the pars flaccida. The cone of light is at 5. The incus, the malleus. Very good. There is no, again, I don't see any redness, erythema, bulging, perforation, scarring, none of those things. Now I'm going to proceed with the whisper test. I'm going to be testing cranial nerve 8, which is the acoustic nerve. So I'm going to stand behind her. If you can cover your right ear, and I'm going to whisper Your right ear. And I'm going to whisper a word. Let me know and tell me what you hear.
Apple.
Very good. Now I'm cover your other ear.
Banana.
Very good. So the whisper test was good. She was able to hear both of the words apple and banana that I had said. So the cranial nerve 8, which is the acoustic nerve, is intact. I'm going to proceed with the Renee's test. I'm going to be using the tuning fork 512 with the I'm going to do the Weber test first, and then I will proceed with the Renee's test. With the Weber's test, I'm going to hit the tuning fork. I'm going to put it in the center of your cranium, and this test is to test for lateralization of sensory neural hearing loss. So you're going to tell me if you're able to feel the vibration, okay? Laterally. If you're not able to hear it laterally, like in both of your ears, then you need to let me know in which one do you hear it more, okay? Let me just. Do you feel it laterally?
Yes.
Okay. So Weber's test was good. She does not have any sensory neural hearing loss. Now we're going to do Renee's test. This is just kind of hard. And this I'm going to put in the mastoid process. Let me know when you stop hearing it.
There. There.
Okay. Now we're going to do it in the other side. Maybe this is kind of hard. I'm going to put it again in the mastoids process. And I'm going to be checking the time. When you stop hearing it, let me know.
There. There.
Okay. So the Renee's test, the air conduction was greater than the bone conduction, which is adequacy. Now we're going to proceed with the nose. I'm going to assess the nose. So I'm going to ask you if you can take off your glasses. I'm sorry. The nose is midline. The skin in the nose appears equal as the rest of the body. There is no redness. She doesn't have any moles. There's not any lesions. I'm going to inspect now at the nares. They are round. She does have some hairs. I'm going to use my pen light to assess the mucosa. The mucosa is pink. I don't see any any polyps. There's no perforation. The septum does look a little bit deviated. I'm going to ask you to close one of your nares and breathe in to see if there's any obstruction. Okay, the other nair. Very good. So there's no obstructions noted. Once again, I'm going to look. They're nice and pink. If the nares were to be very red, that could indicate that she could be having some type of nasal discharge, like continuous. If she, now we're going to test the cranial nerve 1, which is the olfactory. So I'm going to ask you to close your eyes, and I'm going to put some smells, of course. You need to identify what it is. Okay? What do you smell?
Coffee beans.
Very good. Keep your eyes closed and tell me what you smell.
Vanilla.
Very good. So cranial nerve 1, which is the olfactory nerve, is intact. You can open your eyes now. You can put your glasses if you want to. Now I'm going to proceed with the mouth. I'm going to inspect her mouth, her lips. Her lips are moist, they're not cracked. She doesn't have any cracking, any colitis in the sides of her mouth. She doesn't have any lesions, any redness, any maybe even crackling, nothing like that. Open your mouth. I'm going to look at the mucosa, which is pink. Let me get my pen light to be able to visualize. The mucosa is pink. Do ah. The soft palate. I'm able to visualize the uvula, the tonsils, her teeth. I don't see any cavities. They appear to be all natural, like all hers. Her tongue is mid-light. It's pink. Can you put your tongue up? Very good. Her salivary ducts appear to be patent because I do see some saliva there. Very good. I'm now going to test the cranial nerve 9, 10, and 12, which is the glossopharyngeal, the vagus nerve, and the hypoglossal nerve. I'm gonna pretty much do the gag reflex, which is cranial nerve 9. Okay. Let me look at your tonsils with this. Very good. The tonsils are toothless, which indicates adequacy. I don't see any white spots, any pus, any discharge maybe in the back of the throat. I'm now going to ask you to taste, okay? Close your eyes. Could be. Now you can taste. Grab the cup and tell me what you taste.
Sweet.
Very good.
Salty.
Yes, very good. So cranial nerve 9, I'm going to put the tongue plate over here. Cranial nerve 9, 10, and 12 are intact. We are now going to proceed to the chest and the thorax. So I'm going to ask for you to remove your blouse so I can inspect. Very good. And I'm going to inspect your chest. You can take a seat. I'm going to inspect her chest. The skin color is equal. There is no discoloration. There's no bruising. There's no lesions. I'm going to inspect the back. Her anterior posterior diameter. And let me see your transverse diameter. Very good. You can hold your arms like in the front. Very good. Is half of the size. The transverse diameter is half of the size. She does not have any barrel chest, which could be indicative of COPD. Doesn't have pigeon's chest. Her breathing is adequate. She doesn't seem in any distress. Her respiratory rate previously taken, her respirations were 16. I don't see any accessory muscle. There's no retractions. There's no nasal flaring. She's not pursed lip breathing. So just her breathing, as I am inspecting it, appears adequate to what she is doing. She's just sitting down right now. I'm going to palpate her chest. You want to do it with the palm. I'm palpating for any bulges, for any masses, any crepitus, which is air trapped in the subcutaneous tissue. Okay. Now we are going to proceed with a test called tactile fremitus. And for that, you're going to say 99, okay? And I should be feeling some vibrations.
99.
Very good.
99.
Very good. You want to do it in between the lungs so you can feel the vibrations. Say it.
99.
Very good.
99. 99. 99.
Very good.
99.
Very good.
99.
Very good. And I could feel the vibrations. It is very important to feel them bilaterally, one side to the other. If I wasn't able to hear the vibration, it could be caused maybe by a pneumothorax, by an obstruction, maybe a tumor, something that is not letting the vibration of the voice go through the air. So now I'm going to check your thoracic expansion. And how I'm going to do that is that I'm going to put my hands on her back, approximately on her 10th rib. Okay? And I'm going to put them bilaterally. I want to get them as close as to the spine, and I want to push a little bit of skin, and then I'm going to ask her to take a nice deep breath. And both of my hands are expanding symmetrically. Okay, you can, there we go. Both of my hands were able to expand as she was breathing in, as she was inhaling, which means that thoracic expansion was adequate. If only one of my hands were to be going up, it could indicate like a pneumothorax, that her other lung is not, going up, not breathing, not taking the oxygenation that her body, that she is. So now I'm going to proceed with percussion. I'm going to percuss. It is very important to percuss in between the intercostal spaces, and you should be hearing resonant sound. If you hear some dullness, it is kind of hard to do it in the frontal aspect, but it is important to do it. It is hard because of the breast tissue, but you want to do it in the back and between the intercostal spaces. Very good. And just be careful with the scapula because you might hear some dullness with that. And I was able to hear some resonance with my percussion. Now I am going to assess the diaphragmatic excursion. So I'm going to percuss from going up. When I start hearing a dull sound, I'm going to mark it there. But I'm going to ask you to inhale, okay? And try to stay with the inhale. So I have to do it a little bit fast because it's hard to, sustain the inhalation. Okay? I'm going to tell you when. Okay, inhale. Okay, here, I'm going to mark it. Let me get my pen. Oh my word. Okay, I'm going to have to do it again because my pen was far away. Again. Okay, I'm going to mark it here with the pen. I'm sorry. Okay. Now, you're going to do the same thing, but now you're going to exhale and sustain the exhale. Okay? Okay. Very good. I'm going to do it on the other side. Inhale and sustain the inhale. Again, exhale and sustain the exhale. Very good. Now I'm going to be using my measuring tape to measure. It should be no greater than 5 centimeters. Should be from 3 to 5 centimeters. In this case, hers is 4 centimeters, actually. So she has her diaphragm, adequate excursion, diaphragmatic excursion. If the diaphragm were to be smaller, it could be caused maybe by ascites, maybe by emphysema, things like those. So after palpating, I'm going to end up the lungs and the thorax with auscultation. It is very important to auscultate with both the diaphragm and the bell of the stethoscope. Just take, as I put the diaphragm of the stethoscope in your skin, just take nice deep breaths, okay? You can breathe in through your nose, exhale through your mouth. Okay? You can put in your arms in, very good. Her right lung has 3 lobes. put your arms up again. Very good. Very good. So I could hear vesicular sounds. I'm looking for adventitious sounds like ronchi, wheezing, crackles, but I did not hear any of those sounds in her lungs. Her right lobe has her right lung, has 3 lobes. And the left lung has only 2 lobes. It is very important to assess on the middle right lobe, which is best heard on the mid-axillary portion. So her lobe sounded good. Now we're gonna end up this with 3 tests. One is whisper pectoriloquy, one is egophony and bronchophony. So I am going to auscultate and you're gonna whisper 99, 99. Okay, 99. If I hear clarity, that indicates that there might be some consolidation. Okay, whisper. Okay. Very good. So I did not hear with clarity 99. Now we're going to proceed with the egophony. You're going to say E. If I hear an A, that means that there is consolidation. So you're going to say E.
E. E. E. E. E. E.
Very good. And now the last one, which is the bronchophony, you are going to say 99. Okay, but if I hear loudness, then that means that there is consolidation.
99. 99. 99. 99. 99. 99.
Very good. So the bronchophony, the egophony, and the whisper pectoriloquy, they were all negative. I did not hear any abnormalities. So that would be negative for any consolidation. Now I'm going to follow this test with the cardiovascular. So I had already inspected the chest, but you want to inspect the chest once again. You also want to look at the skin. The skin appears tan. She is not having any bruising. I'm going to inspect at the nails because the heart, it is related with our circulation. So her capillary refill is less than 3 seconds, which indicates adequate circulation. I'm also looking at the lower extremities at the feet to see if there's any edema noted. In her case, she does not have any edema. If she were to have edema, that could indicate that could be related to the cardiovascular system. I'm also going to look at her jugular venous. In this case right now, it is kind of hard to observe like a pulsation, but I will ask her to lay down in a little bit. You also want to observe at the point of maximum impulse. With breast tissue, it's a little bit hard, but once she's laying down, I will push a little bit the breast tissue to be able to actually visualize the point of maximum impulse. Okay, so I'm going to ask you to lay down. You can lay down this way. Let me put something because I need to be at 45 degrees. Okay, lay down. And then turn your head that way so I can see. And I'm going to measure the jugular venous pulsation. Turn your head this way. Very good. And there I can see the pulsation. And I'm going to put a straight card and get my measuring tape. And at the angle of Lewis, I'm going to put where the pulsation is at. And get this out. It should not be greater than 3 centimeters. So it looks over here. And it is 2 point, it is at 2, I would say. Okay, so the jugular venous pulsation appears adequate. I'm going to leave this here. I'm now going to palpate. So I already inspected, now I'm going to palpate. I'm going to palpate with the palm of my hand. You want to palpate for any masses. I'm going to palpate the point of maximum impulse, and I do feel it. Okay, can you stand up a little bit, just like that? I'm sorry. Palpate the back. Okay. I'm now going to percuss. See, the cardiovascular system, we do not percuss. So I'm going to go straight to the auscultation. I just remember that. We do not percuss in the heart. So I'm going to auscultate. I'm going to auscultate aortic valve, pulmonic valve, Erb's point, tricuspid valve, and mitral. The aortic is located in the right second intercostal space. The pulmonic is in the left second intercostal space. The Erb's point is in the third intercostal space left. The tricuspid is in the left fourth intercostal space, and mitral valve is in the fifth left midclavicular intercostal space. I will be doing a demonstration of this, and I am auscultating and being alert of any murmurs, any clicks, any rubs. Okay. Pulmonic, Erb's point, tricuspid, and then mitral, which is the point of maximum impulse. With the palpation, when you palpate the point of maximum impulse, you want to see if it's there, if there's no displacement, because that could indicate that the ventricle is maybe enlarged. So that is something that I was looking for as well while I was palpating. I'm going to listen also to the jugular venous, and I'm looking for any bruits. I'm so sorry, but you have to auscultate with both the bell and the diaphragm of the stethoscope. And you also want to do it in different positions. Like right now she's laying down, maybe sitting down, maybe leaning forward, because sometimes some murmurs might not be audible just in the position that you are listening at. So okay, very good. So I'm going to ask you to go in a sitting position now. And I'm going to auscultate again, because as I said, I want to make sure that you don't have any murmurs, any clicks, any rubs. Aortic, second right intercostal space. Pulmonic, left second intercostal space. Erb's, third intercostal space left. Tricuspid, fourth intercostal space left. And point of maximum impulse, fifth intercostal space midclavicular. And I do not hear any murmurs, any rubs, or any clicks in this case. I also want to inspect her hair. This is important because people who do not have a lot of hair, that might be indicative of poor circulation, which is related to the cardiovascular system. In this case, she does have adequate hair distribution, is equally, it is symmetrical. And now I am going to proceed to the abdomen. I'm going to inspect the abdomen. If you can lay down so I can clearly inspect. Okay. The abdomen appears flat. She does have some moles. Yes, because they don't seem to be like birthmarks. Her abdomen is flat. She does not have any bulges, any lesions, although I do want to inspect your C-section scar. Is that okay?
That's okay.
Okay, I'm going to lower this.
It's really low.
Oh, okay. Well, Is it okay if I inspect it? Just to make sure that there's no redness, no lesions.
Okay.
Okay. So the scar appears healed. Okay, you can put it back. It does not seem with any redness. There's no discharge. It didn't give me a foul smell odor, which could be indicative of infection. Um, I'm looking. She does not have any distension. Distension could be indicative maybe of flatus, feces. She does not have any asymmetry, which could be indicative of maybe splenomegaly or hepatomegaly. Her abdomen does seem flat. See, this is the only modality that I'm going to inspect, and then I'm going to auscultate. So I'm going to go directly to the auscultation. You want to auscultate all four quadrants. Ideally is for 5 minutes, but for time purposes, I'm going to auscultate just for a couple of seconds with both the bell and the diaphragm. But in this case, you want to listen with the bell maybe first, starting in the left lower quadrant. Okay. Left upper quadrant. Right upper quadrant. And the right lower quadrant. Okay, I could hear active bowel sounds. They were not hypoactive, they were not hyperactive, they were just normal bowel sounds. I'm going to proceed with auscultating the abdominal aortic artery, and I'm listening for any bruits, which is like a disturbance of sound. Okay, now that aortic artery goes into the iliac arteries, the renal arteries, the femoral, so I'm going to listen for all of that as well. The renal are just lateral to the umbilicus. The iliac are a little bit lower. And then the femoral. Okay. Ideally, it would be best if she were to remove, you want to actually have like the skin by skin, but for privacy purposes, she is not removing her pants. But I did not hear any bruits in the arteries that I had just previously mentioned. Now I am going to percuss. I'm going to percuss her abdomen. You want to do a light percussion because you don't want to overstimulate. Okay? So I'm going to percuss. I should be hearing a tympanic sound. Because it is air-filled, and I do hear a tympanic sound. Now I want to percuss and measure the liver. We want to make sure that her liver is not maybe enlarged. So I'm going to percuss for the liver. Whenever I hear a dull, okay, here, let me mark it down. Oh, I think I panicked. And then you want to go from underneath the breast down. Make sure you don't hit like the ribs because that sound could be dull. Okay. I hear it here. Now I'm going to measure it. Ideally, it's going to be 4 to 6. In this case, it is 5. The liver, which is located in the right side. And then the spleen is kind of hard to actually identify, but what we're going to do is I'm going to ask for you to put this arm up. Okay, very good. And you want to go in the 10th rib, so it's the last one, but then you want to go 2 up. And then you want to percuss going up until you hear a dull. Okay? I hear it here. Now take a nice deep breath. Okay, and I could hear some tympanic sound, which indicated that her spleen is not enlarged, because the tympanic sound is because of the air. If the spleen were to be enlarged, I would still hear a dull sound. So now, after percussing both for the liver and for the spleen, I'm going to now palpate. I'm going to palpate. I'm going to start with light palpation. And I don't feel any masses, any like tumors, anything. And I'm going to proceed with deep palpation. It might feel a little bit tender in this side, just because, that part tends to be a little bit tender. Let me know if it hurts. No? Okay, so now I'm going to do McBurney's sign. That one is to test for any appendicitis. And you want to go in the right lower, where the iliac crest is, which is kind of like near the hip, the right iliac, and the umbilicus. And you want to go 2/3 up, apply some pressure. And when I take out the pressure, if she reported some pain, that could be indicative of appendicitis. You also want to test for Murphy's sign, which would be indication of gallbladder inflammation. This, you're going to engulf on the right side. I'm going to engulf, let me see, her kidney, her rib is over here. So you want to engulf. Okay, and I'm going to ask you to take a nice deep breath. Okay, if she were to have positive Murphy sign, she would not be able to completely take that deep breath, because the inflammation, she would be complaining of a lot of pain. You also want to look for colon sign. That one would be some bruising around the umbilicus, and that is very important, because that could indicate like an ectopic pregnancy, especially in her age group, which she's a 28-year-old. You do want to be looking for that. And that is what ends with the abdominal assessment. For the breast, I would only, for privacy purposes, I will not be assessing the breast, but I would instruct her to do a self-breast examination. And what I would tell her is for her to lift up one of her arms and start palpating for the lymph nodes, and in a circular motion, best done when showering, to palpate in a circular motion from outer to in, for her to inspect the skin, for any dimpling, any redness, for her to look at her nipple, maybe, how do you say it? Maybe to kind of like see if there's any discharge, anything coming out from the nipple, and then proceed. She wants to be alert at any maybe nodules or cysts round that are non-tender, fixed, and that are palpable, non-tender, and fixed. Those may be symptoms of malignancy. So I'm now going to proceed to the musculoskeletal system. So if you can please sit down back again. So I'm inspecting the way she is sitting down. She had no difficulty going from a laying position to a sitting position. So I am observing already the way she's moving all her joints, her major joints, her muscles. I'm looking first, I'm going to palpate the temporal mandibular joint. Open and close your, very good. There's no crepitus. Now move it laterally from one side. Very good. I do not feel any crepitus. I'm now going to proceed inspecting the neck. I had previously already assessed this, but I'm going to ask for you to rotate your neck to your right, which would be there. Do you have any pain?
No.
To your left? Okay, I would have to be doing passive first to make sure that the patient does not have any pain, and then active, which I'm just telling the patient and the patient does it by itself. Her neck is right now extended. I'm going to ask for you to flex, which would be downward. Very good. Now hyperextend, upward. Very good. Now lateral, which would be to one side. Very good. Now to the other, towards your shoulder. Very good. Now I'm going to ask for you to shrug your shoulders. There we go. I'm going to put some kind of pressure or strength. I need to make sure that you have adequate strength in your shoulders, okay? Okay, very good. So she does have adequate strength. I'm going to proceed to the shoulders. So I'm going to ask for you to flex your shoulders. So put your arms up. There we go. Now in a standing position, because that's going to be easier. Now hyperextend, which would be go backwards. There I'm testing for any rotator cuff. Now I'm going to internal rotate, which would be downward. If you can do this towards the back. Now external rotate, which would be upward, like that. Do you have any pain?
No.
Okay, now on the other side, internal rotate, external rotate. I would be testing for any rotator cuff. After checking and assessing the shoulders, I'm going to move to the spine. I'm going to ask you her spine right now, the curvature, as she walked, as I said, when she walked in, she was able to sit down, to walk, her gait appeared normal. She was able to sit down, take off her shirt while I was assessing her chest, her abdomen, all of that. I'm going to ask for you to, if you can turn this way, lean forward so I can see your spine as much as you can. Her spine appears symmetrical. I don't see any scoliosis. Her shoulders are aligned. Okay, you can come back up. Right now she is extended. Right now what she did, she flexed. Now I'm gonna ask you to hyperextend, which would be backwards. Very good. Now I'm gonna ask for you to go lateral to one side, now to the other. Now rotate as much as you can. Very good. Do you have any pain while doing all those exercises? No pain. Very good. Now I'm gonna assess your hip. I'm gonna ask for you to lay down. Lay down completely. And I'm going to extend the hip and flex the knee. Extend the hip and flex the knee. Very good. Do you have any pain?
No.
Okay. Now I'm going to do the same thing on both sides. Extend the hip, flex the knee. Now, can you lay downwards so I can hyperextend your leg to see if you have any hip problems? As she's doing that, I don't see any difficulty with her musculoskeletal. Now, can you with your legs straight, hyperextend it now, which means that you would be doing this. There we go. Now the other one. Very good. Do you have any pain in your hip area?
No.
No pain. Okay, you can now turn. Now I'm going to check the knees. The knee is right now flexed. Extend it. Hyperextend is very difficult. The knee cannot hyperextend, but we can test in lateral rotation, like internal rotation, and then external rotation. Again, the same. Internal rotation, external rotation. Now, I'm going to go to the elbows. I know that I should have gone maybe to the elbows before, but I'm going to go to the elbows. The elbows, if you can please flex, which would be doing this. Now with the other side, flex. Very good. Do you have any pain?
No.
The elbows are extended. Now the wrist, I'm going to ask for you to, the wrist are at an extending position. If you can please flex the wrist. Now hyperextend. Very good. Now adduct, which means that you will you will come in. Abduct with a B. Very good. Now I'm inspecting all her joints. They don't seem to be swollen, enlarged, red. That would be indicative of some arthritis. All her major joints do not feel or see with any redness or swelling, both from her ankles, her knees, her hips, her elbows, her shoulders. I'm now going to ask if you can flex your fingers. Very good. Now hyperextend your fingers. Now if you can adduct your fingers, which is to put them together, and then abduct, which is spread them out. So she does not have any difficulty with those ranges of motion. I already checked for the wrist, hyperextend, extend, adduct, abduct. Now I'm going to ask for you to be in pronation, which is that I'm checking the elbows with this maneuver, and then supination. Very good. I'm now going to proceed to the ankles. I know I'm moving from one part to the other, but I'm now going to continue with the ankles. Are you able? Can you please move this way so they can see the ankles? This way, towards me.
Oh.
Very good. So I'm going to dorsiflex, which means to come on up. Very good. Now to plantar flex, come down. Very good. Now to adduct, in. Very good. Now out. Very good. Now I'm gonna inversion, which means that you're gonna turn kind of the sole of your feet inward. If you can do that, the sole of your feet inward. The other one, very good. Without trying to move a lot of your leg. And then eversion, which means outward now. No problems. Very good. We would be checking when we come to the hips, the Trendelenburg sign. If you can stand up and if you can turn your back, I'm looking at her skin folds. If there's any asymmetry, in this case, her skin folds appear symmetrical. If you can raise one of your legs, there we go. And I see that there's adequate strength to the hip part, to this hip part. If the this is a positive, negative Trendelenburg. If it were a positive, when she would raise her hip would be, it would be kind of equal. You wouldn't see a rising up because this muscle would be weak, which would not be able to, for her to do that movement. I'm going now to do the McMurphy sign to test for any meniscal tear. If you can lay down, I'm going to check, and I'm going to check for any, I'm going to internally rotate and let me know if you have any pain in your in the lateral areas of your knee.
No.
No? Now let's see on this one. Any pain?
No.
Okay. So Murphy sign is negative for any meniscal tear. Now I'm going to do the inversion and when she put her arm up and down, internal and external rotation, that would be testing for any shoulder, any rotator cuff tears. And in this case, they were negative. Her feet, I'm looking at her toes. Can you hyperextend? Very good. Flex. Is it possible for you to flex? Very good. But her feet also, they do not look swollen. They do not they do not look edematous. There's no redness in the joints. So they appear adequate. And that is what concludes the musculoskeletal. And now I will proceed with the neurological. And with that, you can put your shirt back if you want to. I'm going to test for the cerebral part of the brain. So with that, I had already assessed that by her telling me her name, her date of birth. She was alert and oriented to person, place, and time. Can you tell me the two words that I whispered in the whisper test? Do you remember? Do you recall?
Banana and apple.
So she is able to recall. So the cerebral aspect appears to be intact since she is alert and oriented to person, place, and time. And she's able to recall those two words. Now the cerebellar, with that one, we want to check the coordination. So what we're going to do is that I'm going to ask for you to close your eyes and then, well, you're not going to close your eyes yet. I'm going to ask for you with your thumb for each of your finger to touch your thumb. And do it as fast as you can. And now with your other hand, each. Very good. So you have adequate coordination. Now I'm going to ask for you to do the rapid alternating movements. So I'm going to ask you to put your hands on your lap, and then you're going to turn them on and back, on and back. Yes, as fast as you can. Very good. So you do have adequate rapid movement. I'm going to proceed with the finger to nose. So if you can, with your hands on your lap, your finger to your nose, and then alternate. Finger to your nose, alternate. As fast as you can. Very good. I know it can be a little bit funny. Now you're going to do it with fingers to my nose. Okay? I am checking for her coordination, which is intact. Very good. I'm going to proceed with the test. Also for coordination, I'm going to ask for you to stand up and stand up in 1 feet only. And I'm going to see if she has balance. In this case, she does. Very good. I'm going now to do the Romberg test with your feet put together. Very good. Your arms straight. Close your eyes. And I need for you to, I'm here near you. You do have balance. Very good. Open your eyes. So she did not fall. You can lower that. If she were to maybe fall, that would be a negative. That would indicate to me that there's a lack of maybe coordination with all of that. I'm going to ask for you to do the pronation drift. So with your arms like that, now close your eyes. If one of her arms were to be lowering down, I got you. That would be a positive pronation drift. In this case, it is not. Both arms are symmetrical and equal. Very good. You can lower them, open your eyes, and take a seat. I am going to proceed with the sensation test. The sensation test was already tested earlier with the sharp object being touched, and she was able to identify, and the soft object being touched again to her skin, and she was also able to identify. The vibration test was also done with the Weber and the Rene. She was able to laterally identify. There was no sensory neural loss. And she was also able, the Rene test was adequate, but she was able to feel, to identify the vibration. The cortical sensation, I'm going to ask for you to close your eyes, and I'm going to place an object. And you're going to tell me what that object is. So close your eye, tell me what this object is.
A bottle cap.
Very good. This is testing for stereognosis.
A coin.
Very good.
A key.
Very good. Now I'm going, keep with your eyes closed, I'm going to write a letter in the palm of your hand. This is for graphithisia. And you're going to tell me what that letter is.
B.
Very good.
U.
Very good. That was letter U and letter B. So the graphithisia, that was adequate. The cortical sensation was adequate. And I'm going to finish with the neurological doing the deep tendon reflex. So I'm going to use this. I'm going to be checking your brachial reflex. Very good. The biceps, not the brachial, the biceps. The tricep. The radial. Very good. You want to do it bilaterally? Very good. The biceps. So for the biceps, you want to the tricep. You want to see some contraction in the muscle. Very good. Now the patellar. If you want to sit down, it's better when your feet are hanging. So now this one. Very good. Now you want to do the Achilles tendon. It's in the back. Very good. Very good. One of the things that I forgot to do in my cardiovascular assessment that I just remember right now that I said brachial is to check the pulses. So I will definitely proceed with that. I'm going to check the brachial pulse. And I can feel it. It's palpable. I would say a 2 plus. The radial. Very good. The ulnar. Very good. I do feel it. Very good. The femoral, which I had already assessed during the abdominal assessment. Okay, I feel it. Very good. The popliteal. The popliteal can sometimes be a little bit hard to get, but maybe putting both with the, I feel it. Very good. The dorsalis pedis. I feel it. Very good. And the posterior tibialis. I feel it. And I feel it. So you have adequate pulses. Now we want to finish this assessment with some just general health promotion recommendations. For example, the flu vaccine, it is very important for you to get the flu vaccine every year. Also for you to get your pap smear. The pap smear, the recommendations are if they are sexually active or from ages 21 through 29. If everything is normal, to do it every 3 years. In this case, you are 28 years old, and it would be recommended for your age group. Another thing that we want to recommend is if you are, in the pregnancy ages, you do want to be consuming folic acid. Maybe have some vitamins that do contain some folic acid. Just in case that you get pregnant, you always want to be on the safe side, okay? Thank you so much for listening to my health assessment video, and this concludes my health assessment